Welcome to Bright Eyes and Face Med Spa. My name is Morgan Van Solkema. I'm a physician associate, and I'm the lead aesthetic provider here at our med spa. At Bright Eyes, we offer comprehensive medical, injectables, and wellness services. So I'll just kind of give you a brief overview of a few of the services we offer. We offer all sorts of neurotoxins or muscle relaxers like Botox and Xeomin. We offer filler. Filler is phenomenal for replacing volume that we've lost over time to just help give us that nice lift and contour that we need. We also offer a variety of chemical peels and microneedling, which are both phenomenal for stimulating collagen and helping that cell regeneration to resurface the skin and really just give you that nice, healthy, glowy, tight skin. And we'll be going in depth on one of them today. Some of the other services we offer are peptides. Peptides are phenomenal at kind of mimicking what our body does naturally. So peptides can help things throughout the body, like our hair, skin, and nails because of collagen. It can help us just feel less fatigued, more energetic. They can help inflammation and a whole variety of different things that really people see a huge improvement in. One of our new services that I'm very, very excited to talk about is IV hydration. IV hydration is a medical procedure that we do that really helps give you a nice boost of not only hydration, but vitamins. So here we customize our IV bags specifically to tailor what you need and what your body needs. This time of year, everyone is getting sick. So we have an IV bag that is specifically for your immune system. It has different vitamins like vitamin C, B complex, and a whole variety of vitamins and you can add more if you choose. And those things really help boost our immune system as well as hydrating us to make us feel less fatigued, to give us that boost that we need to get us through this winter season. And more importantly, having a stronger immune system will prevent us from having other issues and from getting sick as often. We have a ton of other IVs, IVs that will help give you energy, IVs that will help get you glowy, nice, tight skin. We have IVs that will help your metabolism, just give it a little boost. So come in, I'm excited to see you all here and take a look at our IV hydration menu. The service that we also just added are facials. We have phenomenal estheticians here. They offer customized facials that are tailored to your skin needs. Whether you have acne, hyperpigmentation, rosacea, there is a facial that's catered to your exact skin. The service that we're going to talk about today are chemical peels. Now is the perfect time for a chemical peel. Which sounds kind of crazy because why would you want to peel when you're already dry in the winter? But what we were just talking about before is what to do and what not to do in the winter. So right now, this time of year, it's very cold outside. Our heat is running nonstop, and I have patients come in every single day saying how dry and irritated and burning their skin is. So what to do is continue your normal skincare routine. Don't stop anything, don't add anything crazy. Keep up that cleansing, exfoliating, and toning, and a nice moisturizer. What not to do, speaking about moisturizers. My last patient said to me, I said, "What have you been using since you feel so dry?" And she said, "I'm not even gonna tell you." And so a few of the things that you don't wanna use that the internet will tell you to use, things like Vaseline, we don't want that. Castor oil, beef tallow. All these things seem really popular and trendy on social media, but we don't want them. They're not going to allow those skin cells to regenerate. They just create a really solid barrier, and that's not what we want. So if you want to learn more or you would like to know how to help your own skin, feel free to come in for a free consult. I'm happy to tailor a consult specifically for your skin needs. And today, when we come back from break, we're going to do a chemical peel. I will demonstrate what it is, how we do it, and exactly what to expect in the next week or so after your treatment. Welcome back to Bright Eyes and Face Med Spa. My name is Morgan Van Solkema. I'm the physician associate here, one of the providers, and today I'm going to be demonstrating a chemical peel for you. Chemical peels are phenomenal at stimulating collagen and resurfacing your skin. So now is the perfect time to do them because after those summer months, now we have some downtime in the winter, and it's wonderful to erase some of those dark spots, the hyperpigmentation, any fine lines and wrinkles, any red spots or uneven texture, skin tone. These chemical peels really help lift all of that and make your skin really nice and tight and glowy. So before we got started here, I cleaned our patient's face. I actually did a double cleanse to make sure everything is perfectly clean and we have a fresh slate to start with. And then I'm going to apply the chemical peel here. So I was explaining to our patient that when we do a chemical peel, the first couple passes that we do, I'm going to start here now. The first couple passes that we do, you don't really notice much. Feels a little bit tingly, a little bit cool, that's completely normal. We make even passes across the whole face here until we achieve what we call frosting. And when we have that frosting appearance is how we know that we have achieved the proper depth of skin to stimulate by these acids. As we talked about earlier, this chemical peel, it's a moderate depth chemical peel, which is a combination of TCA acid, salicylic acid, and lactic acid. Are you doing okay? Mm-hmm. Okay. It's moderate depth, which means it achieves that layer of dermis that we want to hit where our collagen cells form. When we hit this layer with these nice strong acids, those cells are stimulated and they regenerate more and more collagen. And that's the goal. It's the goal for anti-aging. It's the goal for erasing any issues we have with the skin. The more cell regeneration we have, the healthier, plumper, glowier skin that we have. So I just did one nice pass across her entire face, and we're going to keep on moving. With this chemical peel specifically, and I say this one specifically because some chemical peels are a much lighter peel, which means they don't hit that layer of dermis that we really want to target for a lot of these issues that patients come in with. So this is a moderate depth chemical peel. What you can expect is day 1, day 2 after the peel, you won't notice anything. You might be a little red, might be a little irritated. That's completely normal. By end of day 2, day 3 is when you really start peeling. You have, it starts in the center of your face and you, like somebody has described it, you kind of look like a reptile. That is normal, that's what we want. That's how we know that we're getting rid of all those superficial dead layer of skin to reveal a really beautiful, tight lower layer of skin. So day 1, 2, won't notice anything. Day 2, 3, you're gonna start peeling. By day 3, 4, and 5 is when the majority of that peeling is gonna occur. You're gonna have really nice sheet-like peeling across the entire face. That's what we want. By day 6, 7, most of that peeling is gonna be gone, or maybe just towards the outside of the face as everything else has peeled away. And then day 7 and on is when you're gonna see all those amazing benefits of the chemical peel. So your skin is gonna feel really tight, really glowy, nice and firm and hydrated. That's exactly what we want, especially this time of year. I have a lot of patients that come in with just really bad dry skin. The cold weather, running our heat, everything is just kind of stripping our skin of its moisture. So it sounds kind of counterintuitive to do a chemical peel and make yourself peel even more, but this is the time that you want that chemical peel. Because remember, it's not just peeling skin, that's what we see on the surface, but what's actually happening deep down is cell regeneration. And that cell regeneration is what's gonna help give you healthier skin, a better skin barrier, so then you won't be as prone to getting so dry and so irritated in these cold winter months. It's also really important, and I've already talked to this patient about it, but it's really important to not go in the sun for about a week after this peel. You want to allow yourself to go through that entire peel process before you go out and expose yourself to the sun. Of course, you wear sunscreen anyways, but even then, I want you to not be in the sun for about an entire week. And this is why I recommend a chemical peel in the winter for most of my patients. Because in the winter we tend to hibernate a little bit more. So now is the perfect time. You can see here close up that this lower portion of the face, we've achieved what we call frosting. And that's what we want. That's how we know that we've applied enough of those 3 acids to stimulate that layer of skin that we need to hit. So I'm gonna stop on that lower part and I'm just gonna continue as we go here. So how do you know if you are a candidate for a chemical peel? I will say, as just kind of a generalized statement, most people are candidates for chemical peels because essentially all we're doing is stimulating your own skin to produce more collagen, and everyone needs that. So it's very few and far between that I would say no to a chemical peel. I would say if you have any active breakouts, any active issues on your face, then I would wait until that resolves before you get a chemical peel. Aside from that, they're phenomenal for pretty much everyone. So this patient will see huge benefits in probably 1 to 2 weeks, but more importantly as time goes on. Because remember, we're helping those cells to regenerate, and that regeneration gets better with time. So we're about done here. We have achieved what we want to see, which is that frosting across the entire face. We have a nice even layer of that white. That's how we know that we hit the right layer of skin. Just gonna check and make sure we got every little area here. And we did her neck as well. Neck looks wonderful, evenly white. Gonna get just a little closer here. And make sure everything's perfect. Are you doing okay?
Mm-hmm.
Burning yet? Spicy? Yeah? Okay. It's usually that last pass or two where people are like, all right, I'm doing good. But it wasn't terrible. She was completely comfortable the overwhelming majority of the time. And now it's getting to where I like to call spicy. The fan is really helpful for that. So now I'm going to apply a retinol cream. This retinol cream is not like the one that you've been using at home. It's much stronger. It's 6%. And so she laughs, right? A lot of people have an issue. I'm gonna start with that retinol cream. You're gonna feel a little bit warm and irritated. That's normal. A lot of people have an issue starting retinol. However, retinol is one of the musts before we do a chemical peel. We call it pre-treating. I require that all of my patients be on retinol at least 0.5 to 1% before we do a chemical peel. And the reason why is because we want those cells to start regenerating and have the ability to regenerate and heal. If we do a chemical peel on naive skin that has never been exposed to retinol, you're not going to get as good of results as we would if you were on retinol. So working up to this, I have been working with this patient for a couple months now. She's been on retinol for quite a while, and she worked through the typical dryness, irritation, burning that retinol causes, and now we are going to get an amazing result with this chemical peel. And then last step, and I know you're pretty spicy probably now, last step is applying the hydrating cream. And as soon as I apply this cream, it almost neutralizes the chemical peel, and you're gonna feel so much better. So let's get this on you real quick here. After the chemical peel, you'll be a little red, a little warm, and your skin might have a little bit of that yellow hue to it. That's completely normal. That is the peel solution, the acids that are in the peel. But surprisingly, the majority of that spicy feeling that you get from the acids will be pretty much gone. How do you feel now?
Definitely better.
Good. And that's it. So I always tell patients to, when you leave here the day of, you're probably not going to want to go out and about, because I want you to leave everything that I put on your face. I want you to leave it like it is. We want all this to soak in really, really nice. I'm going to send the patient home with a second pack of that retinol complex. So the ZO, you're all done here, and you can just stay where you're at and rest. The ZO 3-step peel, which is what we're using, has, it comes with the peel and then the retinol complex. So I'm going to give this second pack of retinol complex to the patient. I want you tonight to wash your face like normal with a gentle cleanser and apply a gentle moisturizer. I already know what moisturizer you use, and that's completely safe for your skin. And then in the morning, I want her to gentle cleanse, and then I want you to apply this retinol cream. And I'm also going to send her home with her own hydrating cream, and you can apply this hydrating cream as often as you want. Today, tomorrow, the next day. What I don't want you to do is, I don't want you to peel what's peeling off your skin. So over the next 7 days, resist the urge to peel or pick at your face. You can use little makeup scissors if you want to clip the edges to make it more comfortable so you don't have too much of peeling skin, but whatever you can, don't peel it away. We don't want to reveal that new skin until it's ready. Aside from that, she can continue her normal life, do her skincare like normal. Just, of course, be really protective of the sun. And in about 1 to 2 weeks, she's gonna have phenomenal, glowing, really, really nice, plump skin. Thank you for joining us at Bright Eyes and Face Med Spa. My name is Morgan Van Solkema. Next time that you come, we are going to talk about our brand new service, which is IV hydration. I'm really excited to tell you all about that, so stay tuned for our next show.